you all for joining. Sorry about the technical challenges. I think those of you online can hear me, and I hear you're from sort of wide and far. So I'd love actually, you heard a little bit about myself and Ms. Crocker, but I would love for you guys, if people are willing to introduce, great. Introduce themselves briefly or tell me where you're coming from and what you work on in the chat, just so I can we can get a little sense of who's sort of in the virtual room. As I said, I'm really honored to be here and really honored that my partner, Ms. Crocker, could join as well. She's a longtime partner. We've been working together for the past year and a half on thinking about school safety and COVID mitigation in collaboration with the White Mountain Apache tribe and Navajo Nation. So with that, I'd like to just kind of go through some slides. Please feel free to add questions too, and looking forward to discussing with all of you. So first, I just want to briefly acknowledge the land from which we're presenting on. So Ms. Crocker is presenting from her school building on the White Mountain Apache Tribe's reservation in Arizona, in eastern Arizona. Officially called the Fort Apache Reservation. And I am presenting from actually Washington and the Coast Salish people's land and Puyallup tribe's land. And much of our work also took place and takes place in collaboration with Navajo Nation and working in the Chinle area, Shiprock area, and Tuba City area. So just some background on some of this project and how this work got started. And I'll just tell you a little bit actually about personal background on this. So in the summer of 2020, I work mostly actually at the Center for American Indian Health on suicide prevention and mental and behavioral health. And as 2020 hit and the summer there started, you know, there was sort of this, schools were all closed, and thinking through how do we help get schools to reopen and reopen safely so that parents feel good about kids going to school. And so we started just sort of exploring different strategies and approaches that states and towns were using all over the United States. And that started with just a couple phone calls. And as schools started to reopen on the reservation, on the White Mountain Apache Tribe's reservation, we started to sort of think through how testing could play a role. And this was prior to vaccines and prior to all of that. So we were really navigating kind of unknown territory here. And what started as a very small pilot program with just 1 or 2 schools and actually turned into a much larger program that's now funded by the NIH to continue our work together with schools there. And a lot of this was motivated, you know, we all know on this call, Native Americans have faced some of the highest COVID-related health disparities of any racial or ethnic group, and that many schools that serving Native American youth were actually closed until March or April of 2021. Some didn't even reopen until really August or September of 2021. So we're closed for an entire year. School closures have resulted really across the board and around the world in massive learning loss and raising concerns related to physical and mental health. And this is, of course, not just in Native American communities, but in communities around the world, but it is exacerbating existing disparities that existed prior to the pandemic, and added urgency to really keeping our schools safely open, to helping students and families learn, grow, and thrive. So there's just a lot of urgency to making sure that schools are safe and kids can attend in-person learning safely. So as I mentioned, since 2021, we partner with schools that serve Native communities in the Southwest to facilitate implementation of COVID-19 testing and support other safe return to in-person learning efforts. We also focus our work right now on understanding the educational, social, emotional, physical, and mental health impacts of sort of the disruption in learning, and as children and family have returned to in-person learning, focusing mostly on Native American youth ages 4 to 16 years old. And the partnership with the White River Unified School District, where Ms. Crocker works, began in the spring of 2021. And we now work across 28 schools across these 2 communities. All of our work is deeply embedded in community engagement. And so we have, these are elders. We sometimes have an elders community advisory board. But in each of our communities, we have community advisory boards that are advising us on our research and practice approaches, and sort of telling us a little bit about like what needs to happen, what are the community's most pressing concerns, and how can we as a team work to address those concerns. The other thing I think just to emphasize is that it's a real partnership between school, community, and our Center for American Indian Health staff. So here you have pictures of a lot of our staff attending different school events, or promoting different types of safety, and even giving some lectures here, and helping with testing, being sort of on site to help with testing. This was a celebration of the Lady Falcons who won the state tournament, well masked in Arizona. And so just sort of being part of the community and really engaging in the community and forming those partnerships is really critical to all this work. The other thing I think we really try and do with this project in particular is that while we're funded through the National Institute of Health, which is focused on research, we really try and partner our research with practice. And so these are just some examples of our work that we've been doing to sort of support the communities. And so none of the research we do is without an additional practice aspect of it. And so we also help to facilitate community of practice related to COVID-19 mitigation in schools, and bring together people and share our resources and try and develop public health resources in conjunction with our research projects. And lastly, I'll just say that all of this work is really contingent on, a deep respect for tribal sovereignty. And so when we do any of our work, including our community practice work, there's just layers of local approvals that we make sure we go through. And so in order to generate community buy-in and approvals. So this is just an example of some of the work we've been doing, and sort of how many approval letters and IRBs we are accountable to for this type of work. So very early on, we thought about, I think most people here might remember COVID, the Swiss cheese analogy. Well, early on in the pandemic, we thought of that, but also thought about, and I remember very clearly a Apache basket that I think uses sap, and is water, can hold water, and thinking about actually how that basket analogy really talks about these layers of mitigation that we need to do to keep schools safe. And obviously, like, these layers and the type of layers have changed over time as vaccines have become available, or as masking has decreased. And so, but thinking about each of these layers sort of being important to sort of ultimately stopping transmission within schools. So the first thing I think we're sort of working on right now, and our research project focuses mostly on testing, but in the wider spectrum of school safety, really thinking about encouraging vaccination. And we all know that vaccines now are available from 6 months and older, and it's really the best way to prevent serious illness from COVID. And so working with schools and the community to promote trust and safety and promote vaccine uptake is really critical to keeping our schools and children safe. So I wanted to point, the Center for American Indian Health has actually a whole resource library that's based on sort of social media kits, fact sheets that can be distributed at different health clinics or through different social media accounts. And there's a whole section just on vaccines, including like this fact sheet here about kids and COVID-19 vaccines, what parents and caregivers need to know. So I just wanted to point you all in that direction in order to make sure people are aware of that resource if that would be useful. Specifically, when working with schools, we think about maybe how schools can actually help with vaccine uptake. And I think this is a relatively, this has been happening for a while, but it's been strengthened. This idea of like public health and school collaboration has been strengthened in the pandemic. And so sometimes we work with schools or help or work with Indian Health Service and schools to host vaccine clinics themselves. So, schools could consider hosting a vaccine clinic, or if you're a health system working with a school to develop that vaccine clinic during the summer or as a back to school event. And of course, this is important for those youngest kids, but also the pediatric booster shots that are available now for 5 to 11-year-olds. Um, and then I think communication with all this is critical. So even developing community clinic information with students via flyers, sending those in backpacks, sending robocalls and texts, really thinking about how the school's relationship with families is an important pathway to reaching families with this type of information. And then schools could also, in these situations, provide an opportunity for parents to opt in to receiving or helping booking a vaccine appointment. So I know in some school districts we work with, parents are actually signing consent forms to allow kids to be vaccinated if Indian Health Service came and did a vaccine clinic right on site. And making it easy and is really important in all this. Masking, I know, has there's been some backlash on masking, but from a health perspective, I think it still is very clear that the evidence says that masking plays a big role in decreasing transmission, particularly with the new variants that are out there, masking of medical grade materials like an N95 or a KN95 and KF94. And the other thing is they do make these masks both in adult sizes, but then there are plenty of these masks that are particularly KN95s or KF94s that are made for kids as well. And those are really high quality. I think if you can't do that, consider surgical mask and double masking in order to improve the fit is also really helpful. And I know when Omicron hit in this January of last year, we worked with schools to make sure we could source really high quality surgical masks for all the kids to make sure that the kids were wearing masks that actually fit the sides of their face. And I think this is particularly important, as we all know, when kids are inside or in crowded spaces and when rates are high in the community. So when rates are high, COVID is more likely to come in, and masking can really help decrease the spread. Now, I know in some states, school mask mandates are not allowed, but I do think tribes often can exercise their own sovereignty to make those decisions about what they want for their schools versus not. And masking, at least in the literature, has not been shown to decrease any type of learning outcomes. And in general, kids tend to sort of, particularly younger kids tend to not even remember they're wearing them at times. So it's kind of a low expense, easy way to decrease and keep schools safer. The other big thing that I think everybody is focused on is enhancing ventilation in schools. And I know this is, having those HEPA filters and windows open if at all possible with a fan maybe pointing out to allow sort of suck the air out. The other thing that can be done, and I've seen this done at several schools, is actually like science projects on the box fan filters. So these are called Corsi-Rosenthal box, but basically attaching air intake filters to a box fan and building those together and using those instead of a commercial sold HEPA filter. The way this can be monitored in schools is you can monitor CO2. There's now monitors that just sort of register how much CO2 is in a room, and that can really give you a sense of how much the air is fresh air versus already breathed air. And then the other thing is you're really aiming for about 4 air changes per hour, which means like the air in the room has completely changed or been filtered 4 times within an hour. And the more air changes, the better, particularly with these new, more transmissible variants. It's going to be, they're just can linger a lot more, disperse a lot more. And so really cleaning the air is really important in all this. And now I'll talk a little bit about testing strategies. So this is where a lot of our work has focused over the last year. And so there's various types of testing strategies that schools can employ that may end up helping schools reduce transmission and identify cases. So this is kind of complicated, but most schools, when they're doing testing programs, initially started out with sort of, let's pilot it among teachers and staff or students. I think over the last year, it's definitely been more universal and included sort of everybody in the building attending in-person learning. There are rapid antigen tests that can be used at schools, such as the Abbott Binax Now or Loom home test kits, or you've seen the iHealth ones as well. Some of those tests can also be used at home. And then there's this idea of front-end PCR pooling, which combines sort of PCR-based but pooled samples together. And that's often used for screening or surveillance purposes. With the rapid antigen test, if you're really trying to like decrease spread, you might consider it 2 times per week. So there were some schools that were doing twice weekly antigen testing, particularly for sports teams to sort of catch cases early. I think more and more in the fall, people will be doing symptomatic testing. So just having some of those test kits at schools for when kids or teachers start to feel sick. And then there are these test to stay, which I'll talk about a little bit later, but test to stay programs are also been really shown to be helpful to keep kids in school who are close contacts. And so that's sort of another option here. Finally, I think another way schools have been using these antigen test kits is backpack programs. So sending one home, 1 or 2 home as well. Whoops. The logistics of antigen tests have sort of the complication of administering antigen tests in schools has been simplified quite a bit over the last year. So initially there were these professional Binax Now version tests that kind of came like 50 to a box or 20 to a box. And for those and many of the other like really early on antigen tests, you needed a CLIA waiver for schools. And a CLIA waiver is fairly simple to get, but you have to sort of apply for it through the federal CLIA waiver mechanism. Those professional or point of care tests do require reporting to a Department of Public Health of some sort or a local public health authority. And they often also required a provider to make an order, which required then a school to have a doctor or other medical professional who could order those up. As you know, as we all know, testing's gotten more accessible and less complicated. And so now a lot of schools use home test kits, or even self-tests that are performed and resulted and interpreted at the school. And for those, you don't really need a CLIA certificate of waiver. And there's not the same type of reporting mechanisms, although that does vary a little bit by state. So those are antigen tests. The other big testing strategy that we see in schools is pooled testing. And pooled PCR testing means that, and I think Ms. Crocker might describe some of this, but basically 5 to 10 swabs are combined. So each student takes a swab, it puts all into one larger test tube, and that test tube is then sent to a lab. And the lab results basically like either the tube, somebody in that tube was positive or somebody wasn't. And then after that, after the pool, we know the result of the pool. In order to find the positive case, antigen tests are used. So you take everybody that was included in that pool, so the 5 kids that are included, and you test them with an antigen test to try and find who is positive. And that's a strategy a lot of our schools in Arizona are using because it's supported by the state. But I know that's been widely available in many other places in the United States. And in terms of pooled sensitivity, so there was a lot of work on this on like whether pooling would be a good way to kind of test a lot of people. And there was some work out of the Broad Institute that really looked at this and found that basically PCR pooling is more than sufficient for asymptomatic screening tests and has similar sensitivity to individual testing. So really wide-scale, this really informed the FDA's recommendation that this is a best practice. And so moving forward, it's sort of a very validated way of testing large populations. And then, as I mentioned, you often use this rapid antigen test to deconvolute the pool or find those positive cases. And they also similarly found that when compared to PCR tests, Binax Now is accurate in detecting COVID-19 in children that have moderate to high viral loads, even if they are asymptomatic, and that these are the children that are most likely to be highly contagious and transmit the disease. So this is just saying that really these antigen tests, a way to sort of conserve them is to do a pooled testing approach, followed by those antigen tests. But those antigen tests, while they may not always identify somebody in the pool who is positive, they're finding the most highly contagious kids in that pool and identifying them to be sent home and to isolate. So that's all to say that there's these multiple types of testing programs. The last one is really test to stay programs, which some schools are working on implementing now, and some, there's quite robust evidence for this. So this, it says, instead of quarantines for close contacts, the close contact students get tested every day. So one group had close contact quarantine for 10 days in this study, and the other group in this study, they were randomized, was allowed to return to school and was tested every day. And what they found was there's no difference between groups in terms of COVID-19 incidence, and that the test to stay group had more learning days. So basically, if I have COVID, but my child is a close contact, that child would be able to go to school and test every day. And assuming they were negative and asymptomatic, they can continue to go to school. And there was no sort of additional spread that was as a result of them going to school. So this has been a really good way to keep kids in school, even though they might be close contacts of people at home. So in terms of evidence for these different types of testing approaches, I'll just say that, you know, there's studies out there, and this is just some of the summary of what evidence exists. So what has been studied so far, and this was a study in 2021 that was published, was that weekly testing can improve detection of cases in schools. And so here you have asymptomatic testing versus conventional reporting. And this is number of cumulative cases per 1,000. So this is just sort of cases identified. And among students, you're identifying just way more cases than you would be otherwise. Testing can also help stop school transmission, even in communities with high incidence rates. So this is a modeling kind of school calculator you might want to go into and use, which is done by Mathematica. But it estimates the COVID-19 transmission reduction in schools under different testing scenarios and community incidence rates. And here we're comparing single antigen testing versus pooled PCR testing versus serial antigen testing. So like twice weekly antigen testing. Oh, sorry, serial is doing 2 in a row. And you can see here that this is in like very high prevalence, or I mean, not anymore, but this is in a higher prevalence community, and this is in a lower community incidence rate. And you can see that basically this single antigen testing can reduce school transmission by 75% versus pooled PCR testing, which was in this modeling study shown to reduce COVID-19 transmission by upwards of 90%. And again, I'll just point you to this URL, which has this calculator. So sometimes schools, or if you're recommending to schools and working with schools, it's a nice way to sort of think about if testing and what kind of ways testing could help. And along those same lines, regular testing in schools can reduce infection. So this report and study found that weekly testing of all students, teachers, and staff can reduce in-school infections by an estimated 50%, which is pretty large. So this basically had different testing scenarios and no screening versus screening for teachers and staff versus universal, and really showing this reduced in-school infections by almost half. And lastly, I'll just say that this was an early study, but we continue to see this, is that school prevalence rates are lower than community rates in a lot of ways, and school does not seem to drive spread. So, you know, for the entire year last year, we watched this very closely, and school positivity rates just seem to be much lower than the community rates. And when we started to see like increases in community rates, such as with Omicron, it often happened before kids were even back in school, suggesting that school doesn't really drive these rates, but basically school mirrors at a lower level the rest of the community and what's happening in the community. And lastly, I'll just say that both our data and data from elsewhere has really suggested that testing brings student and parent and teacher confidence. And so we have found wide scale acceptability of testing programs in schools, as well as that parents and students feel safer in many ways of attending school when testing is in place. And so this is just our data that says 88% of parents and teachers and staff agree or strongly agree that routine COVID-19 testing will help in-person learning be safer. In terms of uptake, so some of our districts, this is kind of average uptake. So we had, when we're consenting people in, or the schools are consenting people into the testing program, that approximately 50% of those that were in attendance were participating in the program for each week. So we saw this really hover around 50% of participation rates, but some schools had way higher. So I know Ms. Crocker will talk about there's probably a lot higher uptake in her school district or her school than others. And so just sort of thinking through, how do you promote this and generate buy-in and uptake with this type of program? So with that, I'd love to turn it over to Ms. Crocker to describe just sort of her experience with all this over the last year and where she's thinking and what she's thinking about for this year.
Thank you, Emily. So basically, navigating COVID in school, it takes a lot of adaptability. It takes a lot of collaboration and planning, reevaluating, and planning again. So we started testing in our school in February of 2021, and we started with just our staff and all of that. So as we started working through bringing our kids into the building, by May, we started testing our kids. At my school, I had an uptake of 70% of my student body and my staff participating, compared to the other schools in my district who were only at about 50. So a lot of that took the trust between the parents and myself, because I really took the personal approach and talked to the parents and showed them, like, well, we're not doing the invasive one, we're doing just the front of the nose for the testing. And so just having that trusted individual in face really promotes and brings the community together towards the common goal of keeping us safe. What else? When we first started, I was very nervous because we first started talking about testing within the schools in October of 2020. So from October 2020 all the way to February, it was literally planning. I was talking with Emily like every single week. I was talking with people from the hospital every single week, just trying to make sure that what policies and procedures I put into place were gonna work and to where we weren't gonna make the spread in schools. And so, like I said, it took a lot of communication. The cross-sector collaboration was imperative. I wouldn't have been able to have such a good uptake and a good program at my site if it wasn't for Emily or if it wasn't for the physicians at the hospital. And so what I've learned a lot through this is the sustainability during the surges. Like I said, you have to be really adaptable, especially when our antigen tests were running low. We had to adapt and we had to change to where I can't even describe it. It's like I said, it's a lot of planning, reevaluating, and planning again. So it's basically, don't get comfortable with what you have because it'll change within a week, maybe even 24 hours. But I also learned about the importance of stakeholder collaboration, basically reaching out and communicating and interacting and getting to know your community partners was substantial. I wouldn't have been able to do it if I didn't have the help of Emily, if I didn't have the help of our local community health representatives or the hospital. So basically, we were all just working together to ensure that our community and our students were coming in safe. Basically, do you guys have any questions? I mean,
Leanna, I'm wondering, could you talk a little bit about sort of how you're feeling about this school year with everything and what you're thinking about that?
Yeah, I'm feeling a lot more comfortable. Like I said, when we first came in, I was literally throwing in, said, we're going to be testing. You can plan this at your school, figure it out. You'll have people to help you. But I mean, we literally built this program from the ground up. So I feel a lot more comfortable coming into this school year. Like Emily has said, our tribe actually put our face mask mandate back on. So it's for indoors. So when we bring our students back in 2 weeks, our students will be masked in our buildings. And so we've also got the green light that we're going to be testing again in our schools. So we'll be testing once a week with our pooled PCR, and we'll do our reflex testing with our antigen. Basically because in our community, we've had an uptick in our cases. I think right now we're up to about 87 positive cases, whereas a couple of weeks ago, we were only at about 5. But I am more comfortable this year, especially since we have the resources and the groundwork pretty much laid out for us. So it's not like we're jumping in this like into the deep end. We're tiptoeing our way in because we know the waters now.
Yeah, that's great. Thanks, Leanna. And I think just one thing you point to that I didn't really cover is that importance of our regular meetings. I think we've had a really nice opportunity to set up a regular meeting with the school district and leaders, and then community partners, the tribe, and Indian Health Service. And it's been, it's only half an hour. Sometimes it goes much shorter or is canceled, but it's given us all of a way to communicate with each other and to work together. And, I think that's been something we've learned over the time that's really important to promote that communication. So the last thing, just sort of to wrap us up, is I did want to share that, again, the center has a number of school resources out there, including a whole toolkit on testing that's actually just about to be released as an update that kind of takes schools through the steps that would be needed to set it up and tries to simplify all that Leanna spoke about. We tried to figure out on the fly, but tries to make it a little bit more digestible and easy for schools. And then there's a number of, as I mentioned, all of those resources to promote masking, to promote vaccination, fact sheets for parents, fact sheets on testing for parents if schools want to do that. So just a number of health communication resources that are there. Yeah, and then Leanna, that's great. openandsafeschools.org is also a great resource. And that's a Rockefeller funded initiative that was really influential in all of our work as well. And with that, I'm going to just thank everybody for their time. And I think both Leanna and I would be happy to answer questions or hear discussion.
Thank you so much, Leanna. Is that me? Okay, sorry about that. Again, technical difficulties, great when it works, not so much when it doesn't. But thank you both so much for that presentation. I hope everyone here found value in the presentation. And I will go ahead and open the floor to questions. If you are here in person, feel free to just raise your hand. If you are virtual, go ahead and type your questions in the chat box. And I can actually go ahead and start us off with a question if you would like, while you guys think of some. So I guess the first question would be, is there still a greater risk for individuals and families who have not chosen to be vaccinated or are not eligible to be vaccinated? And in your experiences, have you seen more schools encouraging or requiring COVID vaccination boosters to return, or is it kind of open to interpretation? And
yeah, I mean, people who are unvaccinated are still at much higher risk of serious outcome. So we think of that as intensive care unit, hospitalization, and potentially death from COVID. So vaccines remain a critically important layer of mitigation to help individuals stay safe from those very serious complications of COVID. We are learning, over time that our COVID vaccines do less to prevent symptomatic infection than we had hoped those original ones were. And I think the public health infrastructure in this in this country is rapidly trying to figure out how do we set up regulatory processes and approaches to kind of keep up with the rapid changing of the virus. But I will just reiterate that, yes, I think vaccines are critically important to protect individual safety. And lastly, in terms of school uptake, my sense from the districts we work with is that nobody is requiring it, but they're strongly encouraging it. And that also means they're doing actions to sort of promote it by holding vaccine clinics, et cetera. And Leanna, do you want to talk about those vaccine clinics at all that you guys have you guys done those?
Yes, we have. So basically with MOAs with the district and IHS, we're able to bring in a vaccination team. As far as the COVID vaccine, we do require that the parents be here or give consent prior to the vaccine, because we know it's a very sensitive subject and it's still the parents' ultimate choice to vaccinate their child on COVID-19. So it's not a requirement here at our school or in our district, but we do set up the opportunity for them to be vaccinated here. You're on mute, Darby.
Versus 20 or 100, what would you use just to?
Can you ask that question one more time? I was on mute, and I'm mute right there too. Okay, now I apologize.
On your pool testing, number one, does the parent have to consent? And then number two, what made you choose 10 in your pool versus 20 or 100?
Yeah, thank you for that. That's an excellent question. So yes, all of our schools do opt-in to testing through consenting. So the consents are included, sort of sent out in backpacks in these back to school packets, et cetera, that would allow a family
Mike
to—
is on the bottom of the iPhone.
Can you hear me? Okay, so, okay. So yes, parents are consenting. In terms of the pool size, so the way we think about this is originally it was 5 to 25, and they were only validated to detect viral load from 25 swabs in the pool. So the testing company we work with does validation studies, and that was sort of what they found to align with the sensitivity and specificity of the testing and the standards they wanted. However, what we do often in practice is we can change the pool size depending on sort of the number of or the incidence rates in the community. So when incident goes higher, we want to reduce that pool size to 5. And that's because we want to sort of maximize our chances of finding the case without using too many of the Binax Now test kits to find the case to deconvolute the pool. So if you had 25 and people in it, then you have to use 25 Binax or antigen tests to try and find who's the positive case, versus when you only have 5, you only have to use 5 of those to really identify the positive case. And so there were definitely times, as Leanna said, when we were like scrambling for Binax and trying to drive them all over the Southwest to get them to different schools. And when we had to really emphasize, like, drop that pool size to 5 because we're not going to have enough antigen tests to deconvolute the pool. And in general, I think it comes down to sort of the volume you want to do of testing. And so, Leanna, I don't know if you've found any differences from like including 5 to versus 25 swabs in a pool, or if it's felt the same regardless of the pool size.
So regarding pool sizes, I didn't really see a difference in like positivity. I did see the difference when we were in our surges and our resources were depleting very quickly. So definitely when we had the smaller pool sizes, it was easier to identify because compared to testing 25 people within 15 minutes to where I was just testing 5 for 15 minutes, it really sped up the process in identifying who the positive was.
And just to say one other thing, which is when you're deconvoluting the pool, the protocol we use right now is you test everybody that was in the positive pool. And then if all of those are negative, you immediately, you do serial testing. So you immediately administer another antigen test. And there's definitely been times when the first round of antigen tests have been negative and the second round somebody's been positive. And so it just adds another sort of added layer of identifying that positive case. So I just wanted to mention that because sometimes then if you have 25 people, you're trying to find the positive case, that's actually 50 tests that have to be administered and each kid has to wait, 15 minutes. And so that can be a lot for anybody. So when you have smaller pool sizes, you're actually able to sort of have fewer kids waiting and it takes less time and in burden.
It also depends on how many positive pools you have too, because there was times where I had 5 positive pools and my maximum would be like 15. So I'd have about 60, 70 people I'd have to test within 15 minutes. So it really just depends on that too.
Okay, I am keeping my eye out on the chat box to see if anyone has questions in there. It doesn't look like we have any questions right now out here, but I do have one more really quick question for you guys, if that's okay. And it's how can parents support school staff as we continue navigating in-person learning, as things keep changing, and we don't even know what's going to happen in like 6 weeks, so.
Definitely be adaptable, be open to communication. I've had parents get mad at me when I'm just like, I'm just doing my job. I'm like, and so definitely just as long as you remind the parents, like, we're all being thrown into this together. So I understand your frustration. I have that frustration too, but we need to work together and be adaptable and accept that this is a part of our life now. So.
I have a question. I have a
go
question. Yes, I wanted to know about your antigen administration and in two reservations, White Mountain and Navajo. What was the variation? What was there a reliability in the testing? That's my question.
Yeah, so we looked very closely at the antigen positivity rate, and we did not see it change at all with different variants. So we continue to think antigen tests are very, very reliable, accurate, sensitive, and reliable. So accurate and reliable, even in the context of different variants for catching illness that will spread to others. So I know now we're seeing a lot of among vaccinated individuals that symptoms start before an antigen test turns positive. So I think just with schools, very important that if somebody's feeling sick, they stay home, and schools and all of us do everything we can to make sure that when you're feeling sick, you don't come to school or work. But I will say that we continue to think, and this is sort of generally in the science, that antigen tests are just as accurate at catching people who are likely to transmit the virus when they have it. So it's not, the PCR test is really good at catching viral load, DNA particles of the virus, but ultimately it's not as good at telling us when somebody's contagious. And so those antigen tests are really important for that. And while the CDC doesn't recommend a negative test on sort of to leave isolation after a positive test, I do know some districts and schools across the country are employing that. So they would like people who have COVID to test negative before returning. So that's like an added safety measure that goes kind of more beyond the CDC's current recommendations. But even in these schools that we work with, and we looked at this incredibly closely, we did not see any difference with the different variants in terms of the sensitivity of those COVID tests, those antigen tests.
Thank you.
I was just going to say one thing is to be, and I'm working on this, I think is to support schools and staff, be grateful. If parents, everybody's doing so much in schools and they're all wearing hats they've never worn and doing like, I mean, you heard Leanna's trying to test 75 people in 15 minutes to keep kids safe. And so as much patience and gratitude that all of us can give to our school teams is really goes a long way, I hope, or at least as a start.
All right, if we do not, I don't see any more questions. If we don't have any more questions, we can go ahead and close out. Thank you again so much, Emily and Leanna, for today's presentation. And to attendees in person here, if you look at the little postcards on your tables, flip them over, there's a QR code. You can go ahead and scan it and fill out our evaluation. And if you are watching on Zoom, Muna's just posted in the chat box a link to the evaluation. We really appreciate any and all feedback you have for us. It's super valuable. And with that note, this concludes session 2. Thank you all again so much for attending. We hope you enjoyed the presentation at least as much as I did, and enjoy the rest of the Emergency Preparedness and Infectious Disease Institute.